A 56-year-old lady presenting with a palpable lump in the right breast. So let's look at these high resolution ultrasounds of the right breast at 9 o'clock. So as you can see in this image, if you see, you can see it's quite distinct, right? There's an ill-defined, taller than wide, lobulated, densely hypoechoic lesion which has got all these spiculated margins, and you can see the hyperechogenicity around as it invades the adjacent tissue and develops a desmoplastic reaction. You can see the hyperechogenicity surrounding the spiculated margins, typical case of a malignancy. And as you can see, the margins are continuing to be ill-defined. As I continue to show you deeper planes, there's like no distinct margin, like it's like a really infiltrative lesion that's been around for quite some time. So I'll show you another section. As you can see, if you can see these small ductal elements that are seen to radiate from the spiculated mass lesion. So this is a Byrad's type A density breast, which is predominantly fibrofatty with very little glandular tissue. When it extends so deep like this and you're not able to clearly see, it almost seems as though there is a fixation into the pectoralis, which is underneath. Now I will also show you there were around 4 to 5 lymph nodes that was identified in this patient. You can see how these lymph nodes are really markedly hypoechoic. You cannot identify any hilum, and you can see actually, you know, in most of the malignancies, if there is metastasis to a lymph node, the lymph node also tends to demonstrate a morphology similar to the primary malignancy. So you can see these small clusters, you know, clusters of microcalcification within the lymph node. Look at them, some of them chunky, and see, look at this. Yeah, so in some cases, when if the tumor has been around for a while, you can see these clusters of microcalcification within these enlarged metastatic lymph nodes. Here's another lymph node that is enlarged. So this is a typical case of a Byrad's 4C malignant neoplasm, probably multifocal in nature, ductal in origin, with metastatic lymph nodes on the axilla, and the contralateral breast was also scanned, and there was no lesion identified. So whenever you're scanning these breasts, you know, you got to be really careful. So while you do obviously see that there is a striking big lesion in one area, be very careful when you scroll into the other areas, because these are all possible areas of extension of the lesion. So it will be very difficult to define a clear margin because it's got a very ductal pattern to it. So probably this will be best seen. Mammogram, 3D mammogram can give you a picture, but it might be well depicted in an MR contrast enhanced mammogram, where we can see the actual extent of the tumor.